Orbital pathology. Orbital anatomy. The orbit is a bony structure in the skull containing the eye and adnexa. Preseptal space is anterior to orbital septum. Orbital space is posterior to orbital septum, involving tissues within the orbit: globe, fat, muscles, and optic nerve. Gross picture: orbital volume 30 milliliters. Anteroposterior depth 4.5 to 5.5 centimeters. Height 4 centimeters. Thinnest walls: medial wall 0.5 millimeter and floor 0.5 to 1 millimeters. Thickest wall is the lateral wall. Bony orbit: medial wall, lacrimal bone, ethmoidal bone, lamina papyracea, frontal bone, maxillary bone, posterior lacrimal crest. Foramina include supraorbital foramen, anterior and posterior ethmoidal foramina, and zygomaticofacial foramen. Lateral wall is formed of greater wing of sphenoid bone, frontal bone, zygomatic bone, and superior orbital fissure. Inferior wall is formed of orbital plate of maxillary bone, orbital surface of zygomatic bone, lacrimal bone, orbital process of palatine bone, and inferior orbital fissure. While the superior wall is formed of frontal bone, lacrimal bone, ethmoidal bone, zygomatic bone, greater wing of sphenoid bone, and foramina, the optic canal, and superior orbital fissure. Orbital apex. It is the junction of the following bones: ethmoidal bone, frontal bone, maxillary bone, greater wing of sphenoid, and optic strut. Foramina include optic canal, superior orbital fissure, inferior orbital fissure, and foramen rotundum. Orbital contents: eye globe, mesenchymal tissue. Muscles include extraocular muscles and smooth muscles, molar muscles. Epithelial tissue, lacrimal gland. 10. Mesenchymal tissue. Nerves, white matter, optic nerve and meningeal coverings. Peripheral cranial nerves, oculomotor, trochlear, and adjacent. Sensory, trigeminal nerve branches, parasympathetic and ciliary ganglion. Blood vessels, arteries and veins. Trochlear cartilage, lymphocytic aggregates with no lymphatics, fibroadipose tissue and dense fibrous tissue, Tenon's capsule and periosteum. Orbital muscles. Striated muscles, 6 extraocular muscles, 4 recti and 2 obliques, levator palpebris superioris and orbicularis oculi. Histology of orbital muscles. They are formed of round small fibers. Larger fibers are central. Fibers may be fine, granular, or coarse, surrounded by endomysium and perimysium. Nerve endings. On plaque, fine and granular fibers. On grape, coarse fibers. Orbital blood supply. Arterial supply. Main arterial supply arises from ophthalmic artery, a branch of internal carotid artery. Venous drainage. Exit the orbit through superior and inferior ophthalmic veins to drain in the cavernous sinus. Lymphatics. The orbit is devoid of lymphatics. Orbital nerve supply. The orbit contains branches of 6 cranial nerves supplying the eye and periocular tissues. Second cranial nerve or optic nerve. Third cranial nerve or oculomotor nerve. Fourth cranial nerve or trochlear nerve. Fifth cranial nerve, trigeminal. Sixth cranial nerve or adjacent nerve. And seventh cranial nerve or the facial nerve. Ciliary ganglion. This is a parasympathetic ganglion located on the floor of the orbit lateral to ophthalmic artery between optic nerve and lateral rectus muscle. Roots. Sensory root. Long sensory root from nasociliary branch of ophthalmic division of trigeminal nerve. 12 millimeters long. Receives sensory fibers from the cornea, iris, and ciliary body. Motor. Parasympathetic root. Inferior division of oculomotor nerve, nerve to inferior oblique. Fibers synapse in the ganglion. Postganglionic parasympathetic axon supplies iris sphincter. Sympathetic root. From sympathetic plexus around internal carotid artery. Do not synapse in ganglion. Supply ocular blood vessels and possibly dilator pupillae muscle.